Okay.
Yeah.
So you give consent. We're recording. I give consent. We're good.
Yes, we're good.
All right. So I'll let you introduce yourself first.
Hi, you guys. I'm Kylie. I'm from Baltimore, Maryland. I'm 19 years old. That's pretty much about me. Also, I like acting as well. So,
Oh, nice. I didn't realize you were so young. You got a lot going actually then.
yeah.
So I'm Michaela. I'm in New York. I'm a registered nurse from the ED, not currently practicing because some high risk and circumstances. So I'm trying to put a lot of content out there for aspiring nursing students, medical field people, because people aren't able to get out and actually experience things right now.
Yeah.
So I'd love to hear stories, insight, advice, whatever you got. So on that note, I'll kind of let you tell your story if you're cool with it.
I'm so sorry about that.
Oh, don't be.
Oh, hold on a second. Let me just text them back.
That's okay.
Okay. Oh my gosh. Okay, I'm ready. All right. So when I first I didn't know that I wanted to be a nurse until I got into my 12th grade year. I actually wanted to be an actress like really, really bad. And I wanted to go to university and my mom was like, I'm not paying for you to go to university and you're going to do acting and blah blah blah, all this stuff. So I ended up changing and I said, okay, well, I'm gonna be a chef. Just not knowing what I was gonna do and what I really wanted to do. I just said I'm gonna be a chef. I did research on being a chef and I just didn't like it. So when I finally told my mom, I was like, okay, never mind, scratch that. I'm going to be a nurse. She's like, okay, at this point, you're just switching careers. Like, she's like, what are you going to do actually? I'm like, Mom, I really want to be a nurse. But she didn't believe that I could be a nurse because she was like, number one, it's hard. And number two, she was like, she didn't think that I was, I guess, smart enough because of my grades in the past from high school, which I really didn't try hard in high school at all. So that's another thing that I want to say to people. Like, just because you didn't try hard in high school does not mean you can't turn yourself around.
I can
So
concur there too because I did not excel in high school at all.
exactly, I didn't either. So my grades are terrible. But I
All
ended
right.
up, I was like, Mom, I can be a nurse. Like, I know that my grades like didn't really show you that, oh, you're the top in the class. You know, I know that, but that doesn't mean anything. She was like, okay, well, you gotta clean up poop. You gotta do this. You gotta do that. So I'm just like, okay, she doesn't believe in me right now. So yeah, I had to basically just apply for college, community college on my own. I actually go to a community college. I applied on my own and I put everything in, did everything. All she had to do was sign my FAFSA, which for some reason parents nowadays they don't want to sign their kids FAFSA. I don't know what the deal is.
It is though. I've seen that.
Yeah. So I had told my teacher, I'm like, she's not trying to sign my FAFSA. I don't know what to do. The teacher had to email my mom and she was like, explain to her why you should sign the FAFSA. So she ended up doing it after a couple times having to convince. So after that, I ended up going to my community college. I actually took 5 classes my first semester of college. I
Nice.
passed, yeah, I passed all of them with A's and B's. First semester, took psychology 101, English, just your basic stuff like that, math. So it was pretty easy. Um, Now I'm in my third semester of college, and I just took AMP1. I was going to take her microbiology, but taking 2 sciences is a bad idea. So that's pretty much how I came about with it.
Nice. So what made you decide to want to do nursing?
What made me decide I want to do nursing, I don't, it just came up. Like, literally, it just came up in my head. I was actually on Fashion Nova looking on Instagram, and some scrubs came up, and I was like, oh, I could be a nurse. Let me look this up.
Sparked an idea though.
Yeah, it was like I did some research about nursing. I started watching hundreds of videos like on YouTube. There's a lot of videos on YouTube about people that are in nursing school. I don't think there's really a lot of pre-nursing videos out there, but it's a lot of nursing student videos. So I started watching Nurse Nook, Fatima, and all them, and I really got inspired, and I started to love it. And I'm like, okay, well let me see how I can be a nurse now. Like, what are the steps? And yeah, I went and researched everything, and I pretty much did everything myself.
Nice.
Yeah.
Yeah, I don't think there's enough content out there in what I've seen either as far as pre-nursing students. People like I didn't have anything to base it off of really when I got started either, except for well, yeah, there was mostly people who were already in it,
Yeah.
and I personally just made a split decision too. Just I was like, oh my gosh, I'm gonna have a kid, I better do something, and then it turned into I guess I'm gonna be a nurse, and I went to I went to community college here in New York,
Yeah.
but they just kept telling me. Actually, I had a couple colleges straight up tell me you're not gonna ever be able to do this, so you should probably pick something else. And I was like, all right, next college, next college, next college, because
It's
I had
crazy.
very good grades in high school because I just wasn't in it, and
I
I,
wasn't.
I think there's a lot to be talked about there, like certain things. Like I heard you mention in some of your content, like it's going to take you a certain amount of years, and it's so true. People don't see that aside from the actual nursing program.
Yeah.
So are you able? Well, COVID, I know, puts things in a different perspective, but are you able to work while you're working on your prereqs?
I actually never worked like a day in my life. My mom, she has to work lots of hours. When I was
Mhm.
living with her, when I was in high school, she was always working like 7 days a week, all day. So I had to babysit my brother and sister, so I never worked. So now I live with my grandparents because she moved further out from my community college, so I couldn't live with her anymore. And I'm still not working. Thankfully, like I'm actually
Right,
blessed because it's a lot.
right.
Yeah.
No, yeah, and then once you get into the program, I mean, it sounds like you have yourself in a good situation then, because actually, I was with my parents when I was working on my degree because it gets really intense,
Mm-hmm.
but and
Yeah.
I don't think people necessarily realize that either. But so are they requiring an associates for you?
Yes, I'm getting my associates, and this actually is going to take 4 years. I've already been here. This is my second year, and I'm ready to finish up. And then I still have one more prerequisite for next semester from fall 2021. Yeah, fall 2021. I have one more prerequisite to finish, and then I'll finally be in the nursing program, and that's another 2 years.
Oh wow.
Yeah, so I don't know how they thought that people will be done in 2 years because that's what it says on there, but
Mhm.
that's not possible. It's not
Right.
possible. Yeah.
It's actually really smart. I don't know if they've talked to you about doing your science courses ahead of time. Like, no one told me that part. I ended up doing an online microbiology course, and it was like conducting these crazy science experiments in my parents' basement. And I'm just like, oh my God, in the
Oh my.
summer, I heard you talk about like them not really giving you financial aid and stuff for the summer. So I
Yeah,
ended up having to pay for that while I'm making all these chemical things happen downstairs, and I'm just like, this is crazy.
that is
But
crazy. But my
but
they don't do that. They don't give you anything. Honestly, they just give you videos.
oh really?
Yeah, they just say, "Here's the video. This is it demonstrated. They demonstrated themselves, and then you basically have a quiz on it or something like that."
Okay. So are there certain things that you do? I mean, like advice for other people who are looking to get into nursing, like right now, because the entire game is entirely different because of COVID.
Yeah,
Um, so they're just, I know there's a lot of people that I've even talked to that are like, oh, I want to be a nurse now. I want to be a nurse. But like, about like the reality in a good way or whatever way, like the real perspective of what it's like for you, especially right now, because you're living it.
yeah. So nursing, I still it's like a really okay. Let me try to put this in a way I can explain it. If you're trying to be a nurse, my biggest tip is to not look at negative videos. It's a whole bunch of negativity on YouTube about why I don't want to be a nurse, why you shouldn't be a nurse, why AMP is so hard and I passed it, I failed it. It's so much that like I was watching them and I ended up getting discouraged myself. I'm like, oh my gosh, they failed AMP 2 times. They had to take so is and people talking about how the nursing program is really hard and I feel like people should start pushing people more. So if people are trying to be a nurse, they should start by just go based off of your experience. Try to communicate with people at your program. Try to communicate with people that at your school that did the nursing. Like, instead of watching people all over from different states, different countries, or whatever. Like,
Right.
that's really important to me. And I think that anybody can achieve nursing, honestly. AMP one, it was not that hard. You just have to put in a lot of hours of studying. And a lot of people don't want to do that. And that's
Right.
what the issue was.
So are you able to give kind of like a rough estimate of how many hours a week you think you put in for your studying?
That's a good question.
I know it varies, right?
Yeah.
Probably a lot.
I spent, I would say, 15 hours. I would sit home, like I said, I don't work.
Mm-hmm.
So I would have to watch videos multiple times. That took at least 3 hours because it's like multiple parts of the videos. The guy that I watched, he had multiple parts. And then I would have to spend the rest of the day studying. And I wouldn't say that I sat straight and just sat for 15 hours and study, but I would constantly be on Quizlet. And I guess I'll be on Quizlet for at least, it's all day, literally. I'm on Quizlet all the time studying because I know that my teacher, he asks his questions weird. Like, I don't really like how my teacher asks his questions. So
Mm-hmm.
I would have to work extremely hard so that I'll be able to know every single detail. It's a lot. It's a lot.
Yeah. Yeah, I agree. What was I gonna say? So you think Quizlet's a good resource for you?
Quizlet is a great resource. I even found the Crash Course app. That's another good resource for practice questions. I really recommend that to people.
Quizlet. Yeah, I agree. There's a lot of things. I'm trying to think back to nursing school. Have you ever, I don't know if they get that far into it yet, but Lippincott and Saunders and those are some more like nurse-based questions, but A&P was like, that was my favorite. That was like that's the good stuff right there. But
it's so many resources for AMP too. So I love
yeah,
it.
they have I think Elsevier is another one. I don't know if you've used them. But I was going to say, I spent a lot of time watching because I didn't understand. I could not grasp what they're saying with the textbook. Like, there's some animation videos, though, on YouTube for, like, all the different processes. I don't know if you've watched those. Those are super cool.
I watched the animation.
Huh?
I said I watched the animations, too. They're good. Yeah. Also, Pearson, it's a textbook, but they have a website, and they have practice questions, labs on there. You can do practice labs. That's good too, but you got to pay for it.
Yeah.
Yeah.
I think, well, this is a little bit of a different perspective for me. It's been a little while for me with that, but I think that I agree. There's a lot of people who talk about it in a negative light, especially when they're in it. Like, I was reaching out to someone who was like nearing the end of a nursing program and they're just ready to completely give up. And I'm like, no, don't do it. Don't give up. But they need to hear like the positive. Like I remember I used to literally sit there because I was working, momming, working, schooling at the same time. I would literally sit there and just write my name in cursive over and over, like with RN at the end of it. So like, this is gonna happen. It's gonna happen. So like, and I remember just like tears coming down, like, all right, I gotta get through it. But I don't know. I feel like people need real perspective because then like even here in New York, probably the same way ever, people are just like, they're so convinced that you just, oh, so you give a medication or a shot and you wipe your butts. And I'm like, I'm sorry, but no, this is not, you guys have an inaccurate perception. Nursing is like so broad and there's so many different places you can go to it. Now, I don't mean to go on a total rant here, but I just want to like get people to get their butts up and try to do stuff. and stop looking at it like it's impossible, because I can't tell you how many people, literally probably like 80% of the people I've encountered along the way just to get to that point have told me, no, 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 what are you doing? Watching me crying on the couch. And I'm like, no, I'm going to keep studying and I'm going to go like put my scrubs in the dang dryer, even though they're white and they're ugly, but it's going to happen.
It is.
Yeah. Have you ever watched, I don't know if I'm allowed to do this, I think, Nurse Blake on Instagram? It is so funny. You have to look it up if you want to laugh. And like nursing students, you'll die. If I'm allowed to say that, like it is hilarious. It puts like more of a humorous perspective onto it. But
I watched that.
Okay. Yeah. I'm trying to think of what else I wanted to say. Go ahead.
I really feel you on that though. Like I just feel like, oh, another good show. Well, I don't really think it's a good show. Another show that came out is Nurses. That show, have you watched it yet?
What, Nurses?
Yeah, it's new. It just came on.
Oh.
Yeah, it's based in Canada. Yeah, you have to check that out. It's kind of, I don't really think it's accurate though.
Oh, okay.
Yeah, but what I was ready to say, I don't remember what I was ready to say. I don't remember what I was ready to say. I forgot.
Oh, but there's a couple other things I didn't know looking back, and I'm sure everything varies across the board with different states and stuff, but I know for me, I was trying to find a way in different points in my associates. I did a community college too, and it took me quite a while because I was trying to perfect my prereqs. So I was trying to get like really nice grades and pretty grades in my science courses so I could carry that over. But the financial aid portion of it, there's a lot of opportunities for grants and scholarships if you really harass the college enough that I didn't know about at the time. But I did end up finding there were a couple of people who got that. And I don't know how feasible it is now. I talked to another nursing student recently, but if you're able to get any sort of clinical experience working, like even if it's like just per diem, if it's not risky, which I really don't know. That's part of why I'm reaching out to all these different people. I wish so bad that I could have gone back and been a CNA or a tech or something, because the perspective it gave all the people who had done that when I didn't was just unreal. And I had no idea what they were talking about. I'm just like, I should have done that and helped them get jobs too once they got out of college. So
I really wish I could have become a CNA, but I just, when you look at the prices for those kind of programs and you got to pay out of pocket, I think, right? Yeah, it was too much, and I didn't have the money for that. So, but if people can do it, they need to do it because.
Yeah, right. I think once you pass a certain point in your degree, though, for an RN, and I don't want to be quoted on this, but I remember it being a thing when I was in school, like they bypassed the whole CNA thing. Like, so you didn't have to take the course, you could just start working. And so I was like, oh, okay. But it was just really helpful to put on your resume too and get the clinical experience. So hopefully COVID's controlled a little more. Have they talked about like program expectations for you guys? Have they changed at all? Do you know?
So for my school, I also wanted to quote you on this too. You said that people think that nursing school is really hard and this and that, but when you look at the nursing school graduation rate, my school is 70%. So that's another thing. Look at the graduation rate. Don't look at what somebody else is saying that doesn't even go to your school. But back to what you were saying. My school hasn't really communicated with anybody unless you're in the program. I haven't talked to anybody yet. I honestly don't know why they're so like quiet and to themselves. Like if you're not in the nursing program, they don't want to basically talk to you. But and then we're at home, so I really want to get in contact with them when it's time to go back to school, and I want to sit down and talk to an advisor. But right now, it just hasn't been. They haven't been answering the phones. It's really weird now. So I can't really tell you about like what my nursing program is doing. I mean, and I tried to reach out to somebody that's in the nursing program, and she didn't respond. So I don't know at all.
I don't know, maybe just keep like harassing and reaching out again. But yeah, that's interesting. Sounds like you're taking all the right steps though.
Yeah, I am. I mean, I'm following that order, and they said that you can apply with one class in progress as
Hmm.
well. So hopefully
Nice.
I get accepted.
I'm excited for you.
Thank
Um,
you.
and I think I wish, like I might have already told you this, I wish I could go back and do what you're doing as you're like documenting the entire process for social media. Like that is so awesome. Someone needs to do that. So
Yes.
I think a lot of people are going to benefit from that because if you're going from like the very beginning before getting in all the way through, and then on top of it, you're doing it amidst COVID, like I just think that's awesome. So props to you. I don't know what other questions I have for you. You got any for me?
Well, I mean, when you were in the program, what's like how many hours do you think that you were studying, and how?
Ooh, uh, well, I will say I think I ended up studying more because I was working a lot of when I was doing my prereqs, I was working nights. So I was really tired. And like when I'm tired, obviously it just takes me longer. Full
Yeah.
disclosure, I have ADHD, but anyways, it's not an excuse. So if you have ADHD, you can go to nursing school. Woo!
Yes.
But anyways, um, so it kind of took me a little while until I found these crazy studying habits. Like I would until I did this. I will say a lot of people looked at me like I was absolutely nuts, but I was so busy working that I would be driving and playing recordings that I had made. I would basically make my own lectures of the content that I've tried to study, and it would just play in my car all the time as I'm driving to work. So I can't really give you an exact number of hours studying, but I learned to do this thing that no matter where I would go, I either would have like pictures of the content that I was supposed to be working on, or I would have papers or index cards in my purse, or they were glued to me, and then I had an agenda. So I I was nonstop studying because I was also really like obsessed with the science part of things, and I just it was all the time, but it was when I would get really,
Time.
huh?
Anytime you have free time, basically.
Yeah,
Yeah.
and as the I think people think it's so hard because I remember, like, I'm kind of a high anxiety person to begin with, but once you get in, it's like, oh my God, I'm starting, and okay, but if I don't pass this semester, they're going to kick me out. Or if I don't pass this, they're going to kick me out because there's those consistent expectations. But if you could just like ignore all that, I don't, I saw some people spending, yeah, some people didn't even study actually, and I don't know how much, I don't know what they did. Then some of those people also kind of failed out too, so I don't know if they were just in it for show or what.
I
Um, I guess it
don't
depends
get
on
it.
what you wanna do too in your own personal life. Probably well, I would study from probably like 8 to 1 or 2 AM after lectures because they started incorporating, um, clinical time, and then like we had a simulation lab, and I know that's got to be totally different now. And then I would get into group studies, which now I'm curious to see. There's probably a lot of like virtual group study stuff too, to review the content over and over and over and over and over and over. But yeah, that was my life for a very, very long time.
So did you so I recently watched a video from this girl. She just posted a video about her failing out of nursing school because she had a bad, like she said that she had a bad teacher. I want to know how you deal with teachers that don't teach, and it's not many resources for nursing students to just go watch somebody else's lecture, and like it is for anatomy. So how did you, if you had to deal with that, how did you deal with that?
With a teacher that like as far as like the content that I wasn't able to get, or just them.
The
I'm not,
professor, she said the professor basically didn't make it clear what would be on the test, and they basically just threw them the book and said, learn it all.
my advice would be in my experience. First of all, welcome to nursing school, because I felt like every minute of it, I had no idea what they would expect, but I'm also like, I try to absorb as much content as I can. But the answer was always, and this is why I could have had a little bit better grades in nursing school, but I was always trying to read, consume all the content, read it all, get all the information I could, everything from all their lecture notes and their PowerPoints and all the hands-on stuff and all the different textbooks we were going through. And at the end of the day, I'm like, wait, what was actually even important here? And what are we studying? Because I don't know. I just know there's a lot of stuff I learned. And then I'd get into a test like, all right, you don't give you like a review guide. Like, so I had a lot of that that was pretty much the entire program for me. I'm not dissing the program that I went to because it was really good. But there was, I'm trying to remember. Once you get into the program, I think the biggest thing that you can do is one, like talk to other students, because once you get in a group, I mean, even if it's virtually, and start bouncing the ideas off each other, you start to gauge like what we're really focusing on. And then questions, if you look at questions, like NCLEX types questions, people who did that through the entire program for whatever topic it was that we were focusing on, they did really, really well on exams, because most of the tests that you take once you're in the program, in my experience, were all based off NCLEX questions. So your board's questions, there might be like one or two things from the textbooks, but it turns into immediate, like they start incorporating select all that apply questions from the get-go. And I didn't know that they were pulling them from what I was actually going to be expected to answer on the boards. So my advice would be study, learn the content, like get the general concepts, but then whatever those concepts are, answer questions. Like I think at one point I talked to a couple people, they were doing a couple hundred questions a day, and it seems like a lot, but whatever that topic is, UWorld for me that is the best resource. That's how I pass my boards. And if you use that one, that Saunders, Lippincott, I'm sure there's a bunch of different ones now, but that was the key to passing any of the exams and not flunking out of as far as your grades each time.
So basically, when I go to the program, I need to invest in UWorld immediately, so that you will be basically, your practice questions are all right there ready for you.
Yeah, or by the Lippincott or Saunders, like just I would ask your college, or different nursing students what the best resources are now. It may have changed a little bit, but I don't think it has. I mean, I have like basically a mini nursing library of all these things at this point. But yeah, I would go back and be like, oh my gosh, that's where this question came from on this test. That's this question from like a year ago when I was studying for my boards. So I wish I had known that. But yeah, questions, answer NCLEX questions, because they're trying to get you in this new mindset. Like once you get into the program, the way you learn, it's hard to explain, but it's totally different. It's based off like just giving you like different patient scenarios for everything, and select all that apply. There's no right answer. There's
Gosh.
I know, I thought it was really discouraging at first, but you just have to learn to think differently is all.
Yeah.
So I don't know. And it sounds like you totally have the drive. You're gonna pass through, fly through.
Like I already do the practice questions. I use these apps are free, luckily, but yeah. So
There's
I understand that.
Resources.
Yeah.
I think. I'm sorry. Go ahead.
I said it's just using your resources. That's the key.
Agreed. Trying to think what else.
So I wanted to share that in high school, like I already said that I was like bad in high school. I actually got put on IEP, like IEP, yeah. So I got put on IEP in high school, and I don't know, it just makes it seem like these schools, public school and stuff like that, they make it seem like you're slow. They make it seem like you can't get through anything. And I just want to tell people, like I know a lot of people that was in IEP as well. Just because you're in IEP you can be a nurse. It doesn't matter. Like what happened in high school doesn't determine who you are. And even they were trying to get me to put, like, when you're in college, you don't, IEP doesn't follow you. So they were trying to say, oh, maybe you should put IEP in so you can get a calculator, blah, blah. So when I get into college, first of all, they let you use a calculator in math class. I don't know if this is just my school, but they let you use a calculator on the final exam. They let you use a calculator. It's crazy.
Really?
It's literally crazy. Yeah.
Yeah, I don't think any of it was possible for me too, because high school and I were not, yeah. But there's a lot of tests they do when you first go in. I don't know if you probably have done some of them, like the different tests
I
when you
didn't have
first
to
start.
do that
Yeah.
because I took SAT prep reading, which that took me out for English, for the English AccuPlacer. So I didn't have to do it. I didn't have to do that. And then my math, I had a they said, oh, if you pass math, pre-college math, and I took that in high school. They said if you pass that with a B, you don't have to take your what's the name. So I passed it with the B, and I didn't have to take the AccuPlacer for math either. So they have different things now, where if you do certain things, like if you have a good SAT score or whatever, you don't have to take the AccuPlacer.
Nice.
So, yeah.
That's good. So I feel like we should like follow this up too. When are you planning on starting your program again?
I'm starting the program spring 2022. Yeah.
Okay. And so you're working on classes from now till then?
Yes.
Nice.
So
I'm so excited. We should do like some follow-ups. You can tell me how it's going and
definitely
all
have
sorts
me
of
on
stuff.
here again when I get in there. I said definitely have me on here again when I finally get into the program, and even when I'm finished, like I'll definitely come.
Oh, anytime.
Yeah.
I would love to see how it's going. You got anything else for me? I'm just over here just trying to, I don't know. I'm the at-home nurse trying to inspire people to go be a nurse or go
Yes.
do more or
I
like
love
tell
it. I love it. I'm here for it.
Huh?
I said I'm here for it. Definitely. I love it. So the
Okay.
TEAS, do you have any advice for the TEAS test? Because I'm about to take the TEAS test in July.
The TEAS test. What's that one?
So that's the entrance exam. I don't know if you had to take the HESI. Yeah.
Oh yeah. Oh yeah. Study. You know what? I'm like I'm a very last minute procrastinating type person. But so I remember like sitting there with the HESI entrance exam study book. I bought it and I was like, I had months and months to prepare, and I'd stare at it and stare at it and stare at it. And I'm like, crap, I should study. I should study. I should study. And then don't cram. But I did cram. I crammed and I crammed and I crammed and I crammed. And I think I ended up doing really well on it. But don't cram. Space it out. Look at the different content. Remember now, it was a long, scary test to wait to figure out what my fate would be of life. But I just remember looking at other people and they're just all getting up and going ahead of me. Like, because I took a long time. I would always take like the maximum amount of time on tests just because I'm like, okay, I want to make sure that and that and that. But I think just don't overthink it. Study the different topics they want you to in general. And I think there's a lot of practice questions, aren't there?
Yes, there are a lot of practice questions, apps that you
So,
can get.
yeah, I think that the key across the board for nursing, practice questions. I would just do practice questions,
Really though.
questions. It's true because they'll come up almost the same exact questions, if not the same.
Right.
I don't want to be quoted, but it seems to be always true. Like all of those questions will come back at you. So I think if you do that, you'll get to a point where you'll start memorizing them because there's a pattern, it seems to be.
Especially the science. I mean, science, they gonna only ask you these questions. They can only ask you so many questions. Like,
right.
Nothing is really gonna change about the body. It's gonna be similar questions. And I wanted to ask you, what was your percent that you had to get for your school? My school was a 58%. I think that's pretty low.
For the HESI?
Yeah, for the HESI.
To be honest with you, I don't remember exact percentage. I think it was For some reason, I want to say an 80, but I don't. I need to look that one up.
Yeah, my school, they said 58%, and then they said reading 68%. I'm like, that's pretty low. I want to get like an 80, but that's, I mean, I feel good knowing that you can basically fail the exam. That sounds
Yeah.
like basically failing it.
Say that again.
I said it sounds like they basically letting you fail it, because like 58, I don't know. It's just weird.
Well, yeah, I honestly don't remember the grades I had to have for that one. But I do know that the higher the grade you get on it, the better of an applicant you're gonna be. So I don't know, but I think questions. And if you're a visual person, I invested in these. This is like one of the things I remember as a highlight of nursing school and before nursing school and A&P and all. I was at my parents' house and I bought, have you ever seen those big Post-it notes that are like the size of a poster?
Yeah.
So I would fill every wall, like their entire hallway, and it would just be content and drawings of anatomy and the body and like random facts and statistics and stuff. And yeah, I don't know. For me, I was in person more, like we'd have to go in and identify different things for A&P. But actually making stuff, yeah, I just remember one of my parents coming home one day and they're just like, oh my God, what's going on? I'm like, do not come in this hallway. Everything is filled. So I was constantly going through these pads of these giant Post-it notes and like just repeating it and repeating it and repeating it and talking to myself about it in the shower once I got all into it because sleep was just inevitable. So coffee, if you like coffee
I
and can
love
do.
coffee.
All right, that's awesome.
Yeah.
Coffee, questions. I'm telling you, I wrote the signature of my name with RN probably more times than I have in my entire career before I ever finished school so that I'd remember to not give up.
Yes.
But it's so doable. So I think that's my spiel there. And if you, I don't know, once you get out there as an RN, you have so much more freedom than I think people really do realize. Not necessarily freedom, but just autonomy, and depending on what type of nursing you try to do, like I would go on rants all the time about the ER because I love it, and it's just like you get to work with everything and see everything. And I was working in a rural area, so I just got to do a lot of things and a lot of experience, and I didn't know that I'd ever be that free as a nurse, and to be able to have like the hands-on impact, that's just you can't replace that.
I hope that I have hands on, because it's gonna be scary. Like if they have us literally go through the nursing program, it's gonna
Right.
be scary. We
Well,
only
yeah.
know how to work for dummies, basically, not real people.
Well, if it makes you feel any better, I had a vomiting, defecating, urinating simulated body at one point for our clinicals and like really good schools. And this was at a community college, but like we would have to run codes and scenarios on these like the bodies, the simulation or models. I don't know what they call them now, but I'm just like, oh God, like I don't know what they're actually doing right now, but oh, I think it's puking. So
Yeah, I mean, whatever they have to do to make it this real experience, I love it. I don't care.
There's something I did too. It was totally on my own in nursing school, and it was partially to keep me motivated. There's apps where you can do like not live simulations, but you just kind of put in your credentials or what you're doing or your profession, and you can do kind of like virtual simulations. And that helped me a lot because I didn't get a lot of the clinical time that I wanted. I mean, again, I'm not discrediting the college I went to, but it was just there was a lot to cram in with a lot of students.
Right.
And so doing that helped me a lot because once you get out there, it's very different. But
do you think that your program prepared you for nursing school? Not nursing school, I'm sorry. Nursing.
I do, but I have heard a lot of people say this, and this isn't, I'm not being negative, but just honest. A lot of people have said like when I finished the whole thing, the whole like, I don't know if I have any hair left, and I'm gonna just like crawl to this finish line, and I'm just like crying at graduation. 'Cause I'm like, I made it out alive. I thought I knew a lot, and then I got a job, and I was like, oh my god, like I'm alone, but I'm not alone. And I was working under a preceptor because that's the way it goes in New York, and that's when I really got all the clinical skills. That's that's when I really started learning, was actually when I was in the field, or I was in I did a med surge floor. If you go into acute care in the beginning, strongly encourage anyone to do med surge. Actually, I think it was a requirement if you wanted to go into different specialties like I did, because it just gives you such a broad variety of different patients and experiences. And yeah, I do think it prepared me. But as far as, it's really like putting all of what you learned into play, like into
Right.
action, actually executing it at the end once you're done. And so I found myself a lot of times being like, oh, that's what this was. That's what we were learning about here. That's what we're learning about here. And then I think it's just, at least for me, I don't know about other nurses, it's a never ending learning process. So like even to this day, I mean, I'm not currently practicing, but um, even now when I think of different things that have come up with patients, like going home and putting in the time and effort to research whatever you dealt with that day and review it, like it's really, it should be a requirement. And I mean, you have to do a lot of different educational things and certifications once you're out as a nurse anyways, but like putting in the time to study stuff and review it,
That's
I,
important.
yeah, yeah. So I think, yeah, I feel like school did prepare me. Um, I just, I can't imagine, and I don't really know yet all of what it's like for the nursing students right now. So I don't know. I would really like to just, especially as you go along, like kind of share some stuff that you're experiencing, so we can like help lift each other up and give students different pieces of advice to get them through it, because they're all scared. Well,
Yeah.
not all, but a lot.
Yeah, I actually got to talk to a nurse that just graduated this year during COVID, and my grandfather was getting a colonoscopy or whatever, and she's a new nurse, and she said they hired me. I didn't even take my NCLEX yet. They just hired me. She was like, "Don't give up. Just stay with it." And
Right.
I was like, "Wow, you don't even have your license? That's crazy." So
Yeah. So just another thing would be just, there's always the legal portion too. So just be careful. I wish in the very beginning I had invested in malpractice insurance. I didn't really talk about it a lot when I was in school. Just as a safety net with your RN license, because you work so hard to get it, just to cover yourself too. Um, but yeah, it's gotta be really, really different. So I don't know.
I just can't believe they hiring people with no license. My
Yeah,
but she's like, "You're getting your license. I don't care if they're letting you're getting it." Like, okay, okay, but
well,
yeah,
I'm trying to think of like the positive side of this too. Um, I don't know. I mean, you get a lot of experience real fast.
you do. You get
Yeah,
to move out maybe because you're making a lot of money now, faster than you thought.
just yeah, just do it with cautious. I don't know, careful actions, I guess,
Yeah,
especially once you're practicing. But you can do it. You're way ahead. You're only 19. You got this. You got this. I'm so
it is
excited.
crazy because I literally be like, "I need to hurry up. I need to hurry up," and I'm ready to go, and I'm only
Oh,
19.
no, it's good. It's awesome. Are you planning on stopping at your RN or?
I'm gonna go back and get my bachelor's. My the hospital that I want to work at, hopefully they pay for me to go back to get my bachelor's.
Yeah,
Cause
that's a big thing.
yeah,
A lot of them do that.
so that's what I'm looking forward to. I'm like, I'll pay for the associates, which I'm not really paying for because my school, they have this amazing program called College Promise, and they actually pay for people to go to school. Like if you make under 100K, they'll pay for you to go to school.
Oh,
And
wow.
it's completely free as long as you have 12 credits.
That's awesome.
Yeah, so I love that. So I'm technically not paying for school.
You'll come out of this rocking it. That's so exciting.
Yes.
Is there anything I can do? Anything I can help you with, or things that maybe, I don't know, any insight, any questions or resources? I mean, if I could, I'd send you all my books, but I don't know if COVID really likes that.
Yeah. At the moment, no, but I really appreciate you, and I'll definitely be hitting you in your DM or emailing you and letting you and just asking you questions as I go through this, just for motivation and stuff like
Yeah.
that.
Oh my God, I'll lift you up every day. Every day. You're gonna be a nurse.
And I'm definitely gonna keep documenting because, like you said, nobody is really documenting start to finish.
Right.
I definitely want to show that to people so they can be motivated.
I love it. I love it. I'm gonna I'll put out some stuff about following you too. If you don't mind, I'll put it in like the comment section or something of all this.
That's perfect.
All right. You want me to let you go now?
Yes. Thank
All
you
right.
for having
Yeah.
me.
Thank you. I'll talk to you more. Okay.
Okay. Thanks.
All right. Good luck.
You too.
Bye.
Bye.